Come to our comprehensive exploration of eyelid disorders. The eyelids play a crucial role in protecting our eyes, maintaining moisture, and ensuring clear vision. However, various conditions can affect their function and appearance, ranging from mild irritations to chronic diseases. In this video, we'll delve into the classification, symptoms, causes, and treatments of common eyelid disorders. We'll cover both traditional and modern perspectives, highlighting key differences and similarities. With eyelid is a complex structure composed of skin, muscle, connective tissue, and glands. Its main functions include shielding the eye from debris, regulating light entry, and distributing tears across the cornea. The meibomian glands, located within the eyelids, are essential for producing the oily layer of the tear film. Any disruption in these components can lead to various disorders. Understanding the anatomy helps us appreciate how diseases manifest and why certain treatments are effective. Traditional medicine classifies eyelid disorders based on their appearance and symptoms. Categories include granule-like, polyp-like, cyst-like, heavy lids, and malfunctioning lids. Each type has distinct characteristics and underlying causes. For example, granule-like disorders present as small nodules, while cyst-like conditions involve fluid-filled sacs. Heavy lids may result from chronic inflammation or structural changes. Malfunctioning lids can lead to incomplete closure or modern medicine categorizes eyelid disorders based on their pathology and clinical presentation. Common types include chalazion, hordeolum, trachoma, allergic reactions, and tumors. Each disorder is defined by its cause, such as infection, inflammation, or hypersensitivity. For instance, chalazion is a chronic granulomatous inflammation of the meibomian gland, while hordeolum is an acute suppurative infection. Trachoma is a chronic keratoconjunctivitis caused by Chlamydia trachomatis. Chalazion is a chronic non-infective granulomatous inflammation of the meibomian gland. It often presents as a painless swelling on the eyelid with mild heaviness. Predisposing factors include refractive errors, habitual rubbing of the eyelids, blepharitis, diabetes, and metabolic imbalances. Children and young adults are more commonly affected, though it can occur at any age. The pathogenesis involves mild infection, proliferation of duct epithelium, blockage of the gland, and retention of fatty acids. Clinically, chalazion appears as a small, firm, non-tender swelling slightly away from the lid margin. It may point on the conjunctival side as a red, purple, or gray area. Marginal chalazion can present as a reddish-gray nodule on the intermarginal strip. Multiple chalazion may involve one or more eyelids. Larger chalazion in the upper lid can press on the cornea, causing astigmatism and blurred vision. In the lower lid, it may lead to eversion of the punctum, epiphora, or entropion. Occasionally, chalazion may resolve spontaneously, but complications can arise. Larger chalazion can distort the cornea, leading to astigmatism and blurred vision. If it bursts on the conjunctival side, it may grow a mass of granulation tissue. Secondary infection can cause hordeolum internum. Calcification and rarely malignant transformation into meibomian gland carcinoma may occur, especially in elderly patients. Recognizing these complications is important for timely intervention and prevention. Treatment of chalazion depends on its size and duration. Small, soft, and recent chalazion may resolve with conservative measures such as hot fermentation, topical antibiotics, NSAIDs, and steroidal ointment. Intralesional steroid injection, like triamcinolone, can be used for persistent cases. The most effective treatment is incision and curettage, performed under local anesthesia. The contents are scooped out and the cavity is cauterized to prevent recurrence. Recurrent chalazion, also known as recurrent meibomian cyst, is characterized by repeated episodes of swelling and inflammation. It may be associated with underlying conditions such as blepharitis or metabolic disorder. Treatment involves addressing the root cause, using medical therapy similar to hordeolum externum, and surgical drainage if necessary. Persistent cases require careful evaluation to rule out malignancy. Preventive measures include maintaining eyelid hygiene and managing a sore. Internal hordeolum, or cumbicula, is a suppurative inflammation of the meibomian gland caused primarily by staphylococcal infection. It presents with intense pain, swelling, and tenderness, often away from the lid margin. Pus points on the tarsal conjunctiva, visible as a yellowish area when the lid is everted. Treatment includes medical management similar to hordeolum externum and surgical drainage through a vertical incision. Early intervention prevents complications and promotes healing. Thigh or external hordeolum is an acute suppurative inflammation of the glands of Zeiss and Moll. It is commonly caused by Staphylococcus aureus and affects children and young adults. Symptoms include pain, swelling, mild watering, and photophobia. The swelling is localized, hard, red, and tender at the lid margin. Visible pus may develop at the affected cilia. Treatment involves hot compresses, antibiotic eye drops, ointment, NSAIDs, and oral antibiotics. Recurrent styes required. Meibomitis is a generalized disease involving acute suppurative cellulitis of the lid with multiple openings. It may present as superficial tiny white cysts, milia, on the eyelid surface. The condition progresses through stages of inflammatory swelling, pus formation, and multiple openings. Treatment includes eyelid hygiene, hot fermentation, and medical therapy to reduce inflammation. Severe cases may require surgical intervention. Maintaining eyelid cleanliness is essential for prevention. Glaucoma is a chronic keratoconjunctivitis primarily affecting the conjunctiva and cornea. It is caused by Chlamydia trachomatis, belonging to the PLT group. Trachoma is characterized by mixed follicular and papillary response. Predisposing factors include infancy, childhood, female sex, poor socioeconomic status, dry climate, and unhygienic condition. The infection spreads through direct contact, airborne or waterborne modes, and contaminated material. Understanding. Trachoma involves chronic inflammation of the conjunctival epithelium and subepithelial layers. Early stages show epithelial hyperplasia and lymphocytic infiltration. Increased vascularization leads to follicle and papilla formation. Healing is marked by cicatrization, resulting in scarring, dryness, and structural changes. The conjunctiva loses transparency and ghost vessels remain. Herbert's pits and corneal scarring are common. The extent of secondary infection influences the severity. Symptoms of trachoma vary depending on the presence of secondary infection. Without infection, patients experience mild foreign body sensation, occasional lacrimation, stickiness, and scanty discharge. With secondary infection, mucopurulent conjunctivitis develops. Signs include congestion of upper tarsal conjunctiva, follicles resembling sago grain, papillary hyperplasia, conjunctival scarring, and concretion. Corneal signs include superficial keratitis, Herbert follicle. Trachoma is graded using Macallan's classification, which includes 4 stages: incipient, established, cicatrizing, and healed. Complications include trichiasis, entropion, symbolfiron, corneal haze, vascularization, conjunctival xerosis, exposure keratitis, ptosis, dacryocystitis, and corneal ulcers. Degenerative changes such as concretions may occur. Early detection and management are vital to prevent vision loss and long-term sequelae. Treatment of trachoma includes prophylaxis at family and school level, such as avoiding shared towels and maintaining hygiene. In endemic areas, azithromycin is given as a single dose. Medical therapy involves sulfacetamide drops, tetracycline or erythromycin ointment, and systemic antibiotics. Complications may require surgical intervention. Preventive measures focus on hygiene, fly control, and avoiding contact with infected material. Community education is essential. Concretions are accumulations of dead epithelial cells and mucus in depressions of the glands of Henle. They appear as small, white or yellowish spots on the conjunctiva or eyelid. Concretions may cause mild irritation but are generally harmless. Treatment involves removal if symptomatic. Maintaining eyelid hygiene helps prevent recurrence. Concretions are often seen in chronic inflammatory conditions such as trachoma. Allergic lid edema, also known as angiotic edema, is characterized by sudden swelling of the eyelids due to hypersensitivity reaction. It may be triggered by allergens such as dust, pollen, or medication. Symptoms include redness, swelling, and discomfort. Treatment focuses on eliminating the allergen, using antihistamine, and applying cold compressives. Severe cases may require corticosteroids. Early recognition and management are crucial to prevent complications. Allergic dermatitis and conjunctivitis of the eyelid are common hypersensitivity reactions. Symptoms include itching, redness, swelling, and watery discharge. Allergens such as cosmetics, dust, and pollen are frequent triggers. Diagnosis is based on clinical presentation and exclusion of other causes. Treatment involves eliminating the allergen, using antihistamine, and applying topical corticosteroids if necessary. Maintaining eyelid hygiene and avoiding irritants are key preventive measures. Allergic conjunctivitis is an inflammation of the conjunctiva due to allergic or hypersensitivity reaction. It may be immediate or delayed, with conjunctiva being more sensitive than skin. Types include hay fever conjunctivitis, seasonal and perennial allergic conjunctivitis, vernal keratoconjunctivitis, and atopic keratoconjunctivitis. Symptoms are intense itching, burning, watery discharge, and mild photophobia. Signs include hyperemia, chemosis, and mild papillary. Treatment of allergic conjunctivitis involves eliminating allergen, using vasoconstrictor, sodium chromoglicate drops, and systemic antihistamine. Steroid eye drops are reserved for severe cases. Desensitization may be tried in recurrent cases. Local palliative measures provide immediate relief. Maintaining eyelid hygiene and avoiding irritants are essential for prevention. Early intervention helps reduce symptoms and prevent complications. Edema due to recurrent conjunctivitis is characterized by swelling and discomfort. It may result from repeated infection or allergic reaction. Symptoms include redness, swelling, and pain. Treatment involves addressing the underlying cause, using antihistamine, and applying cold compressives. Maintaining eyelid hygiene and avoiding irritants are important preventive measures. Early management prevents chronic changes and improves outcome. Multiple chalazion involves several painless swellings on the eyelid, often associated with chronic inflammation. It may affect both upper and lower lids. Treatment includes incision and curettage, hot fermentation, and topical antibiotics. Persistent cases require evaluation for underlying conditions such as blepharitis or metabolic disorders. Maintaining eyelid hygiene is crucial for prevention. Early intervention ensures better outcomes and reduces recurrence. And eyelid tumors include hemangioma, wart papilloma, dermoid cyst, sebaceous cyst, nevus, and granuloma. Hemangiomas are blood vessel lesions, while dermoid cysts are present since birth. Sebaceous cysts are freely movable and may have pigmented spots. Nevus is a congenital discoloration commonly seen at mucocutaneous junction. Treatment involves excision for symptomatic or large lesion. Benign tumors rarely cause complications but should be monitored for changes. Malignant eyelid tumors include basal cell carcinoma, squamous cell carcinoma, malignant melanoma, adenocarcinoma, and secondary metastases. Basal cell carcinoma is locally malignant but does not metastasize. Squamous cell carcinoma is more aggressive and may metastasize to lymph nodes. Malignant melanoma and adenocarcinoma require prompt diagnosis and treatment. Early detection and excision are vital to prevent spread and preserve vision. Dermoid cysts are present since birth and are fixed to the bone beneath the skin. The overlying skin is freely mobile. Sebaceous cysts resemble dermoid cysts but are freely movable on the underlying bone and often have a pigmented spot. Treatment involves intact excision. These cysts are generally benign and rarely cause complications. Regular monitoring ensures early intervention if needed. Basal cell carcinoma, also known as rodent ulcer, is a chronic ulcerative condition of the skin with everted edges. It is locally malignant but does not metastasize. Commonly affects the lower lid near the inner canthus. Treatment involves excision and monitoring for recurrence. Early detection is crucial to prevent extensive tissue damage and preserve eyelid function. Squamous cell carcinoma is less common but more aggressive than basal cell carcinoma. It often metastasizes to regional lymph nodes and affects elderly individuals with fair complexion and chronic sun exposure. The lesion starts small but may rapidly grow into an ulcerative mass with ill-defined edges. Treatment involves excision and monitoring for metastases. Early intervention improves prognosis. Chronic allergic conjunctivitis is characterized by persistent inflammation of the conjunctiva due to allergic reaction. Symptoms include itching, redness, swelling, and watery discharge. Treatment involves eliminating allergen, using antihistamine, and applying topical corticosteroids if necessary. Maintaining eyelid hygiene and avoiding irritants are essential for prevention. Early management reduces symptoms and prevents complications. Acute allergic conjunctivitis, also known as IMSLI, presents with sudden onset of itching, redness, and swelling. It may be triggered by environmental allergens such as dust or pollen. Treatment involves antihistamine, cold compresses, and avoiding the allergen. Severe cases may require corticosteroids. Early intervention ensures rapid relief and prevents chronic changes. Blepharospasm is characterized by sudden and involuntary opening and closure of the eyelids. It may result from affections of the third cranial nerve or muscle dysfunction. Symptoms include frequent blinking and eyelid closure. Treatment involves addressing the underlying cause, using muscle relaxant, and sometimes botulinum toxin injection. Early recognition and management are important for improving quality of life. Agophthalmos is the inability to fully close the eyelids, leading to exposure of the cornea. It may result from nerve damage, muscle dysfunction, or structural abnormality. Symptoms include dryness, irritation, and risk of corneal ulceration. Treatment involves lubricating eye drops, taping the eyelids, and surgical correction if necessary. Early intervention prevents corneal damage and preserves vision. Eyelids may result from chronic inflammation, structural changes, or muscle dysfunction. Symptoms include drooping, discomfort, and impaired vision. Treatment involves addressing the underlying cause, using medical therapy and surgical correction if necessary. Maintaining eyelid hygiene and regular monitoring are essential for prevention. Early management improves outcomes and reduces complications. Malfunctioning lids can lead to incomplete closure, abnormal movement, and impaired protection of the eye. Causes include nerve damage, muscle dysfunction, and structural abnormality. Symptoms include dryness, irritation, and increased risk of infection. Treatment involves lubricating eye drops, muscle relaxant, and surgical correction. Early intervention prevents complications and preserves vision. Granule-like eyelid disorders present as small nodules or bumps on the eyelid. Examples include Pathaki, Vatmashakara, Ashavatma, and Anjanamika. These conditions may result from chronic inflammation or infection. Treatment involves medical therapy, incision and curettage, and maintaining eyelid hygiene. Early intervention ensures better outcomes and reduces recurrence. Polyp-like eyelid disorders present as protruding masses or polyps. Examples include Shashkasha and Shonitasha. These conditions may result from chronic inflammation or viral infection. Treatment involves excision, cryotherapy, and maintaining eyelid hygiene. Early intervention prevents complications and ensures rapid recovery. Cyst-like eyelid disorders involve fluid-filled sacs such as Atsangini, Kambhika, Lagan, and Arbad. These conditions may be congenital or acquired. Symptoms include painless swelling and discomfort. Treatment involves excision, drainage, and maintaining eyelid hygiene. Early intervention ensures better outcomes and reduces recurrence. Eyelid disorders include Bahal Vatma, Klishta Vatma, Shava Vatma, Bisa Vatma, Praklina Vatma, Aklina Vatma, Vatma Kadama, and Vatmavabandha. These conditions may result from chronic inflammation, structural changes, or muscle dysfunction. Symptoms include drooping, discomfort, and impaired vision. Treatment involves medical therapy and surgical correction. Early management improves outcome. Malfunctioning lid disorders include Vatahata Vatma, Namsha, and Pakshamakopa. These conditions may result from nerve damage, muscle dysfunction, or structural abnormality. Symptoms include abnormal movement, incomplete closure, and impaired protection of the eye. Treatment involves lubricating eye drops, muscle relaxant, and surgical correction. Early intervention prevents complication. Eyelid tumors are classified as benign or malignant. Benign tumors include hemangioma, wart, dermoid cyst, sebaceous cyst, nevus, and granuloma. Malignant tumors include basal cell carcinoma, squamous cell carcinoma, malignant melanoma, adenocarcinoma, and secondary metastases. Early detection and excision are vital for preventing complications and preserving vision. Regular monitoring ensures timely intervention. Prevention of eyelid disorders involves maintaining eyelid hygiene, avoiding allergens, and regular monitoring for changes. Early intervention and medical therapy reduce symptoms and prevent complications. Community education and awareness are essential for reducing transmission of infectious diseases such as trachoma. Regular eye checkups ensure early detection and management. Summary: eyelid disorders encompass a wide range of conditions, from mild irritation to chronic diseases and tumors. Understanding their classification, symptoms, causes, and treatments is essential for effective management. Early detection, maintaining eyelid hygiene, and timely intervention ensure better outcomes and prevent complications. Regular eye checkups and community education play a vital role in promoting eye health. Takeaways from this video include the importance of eyelid hygiene, early detection, and timely intervention in managing eyelid disorders. Understanding the classification and clinical features aids in accurate diagnosis and targeted therapy. Preventive measures and community education are crucial for reducing transmission and promoting eye health. Stay informed and proactive to ensure healthy eyelids and clear vision. Thank you for joining us on this journey through eyelid disorders. We hope this guide has provided valuable insights into the classification, symptoms, causes, and treatments of common eyelid conditions. Remember, maintaining eyelid hygiene, regular eye checkups, and early intervention are key to preserving eye health. Stay informed and consult a healthcare professional for any concern. Wishing you healthy eyes and clear vision.